is Daniela Bustamante and I'm from Catholic University and I'm going to talk about 29-year-old man with dyspnea and chest pain.
If you are immobile for an extended period of time because of surgery, pregnancy, illness, or travel, you may be at risk for deep vein thrombosis, or DVT, a condition where a blood clot forms in a deep vein in the body, typically the leg. Unlike arteries, which rely on the heart to force blood through them, veins transport blood with the help of muscle contractions while you move and walk. Veins also have valves that keep blood from flowing backward and pooling in your arms and legs. When you are immobile for an extended period, your venous circulation slows down. As a result, clotting factors in the blood may cause the slow-moving blood to clump together, forming a blood clot or thrombus. This condition is called deep vein thrombosis, or DVT. Common symptoms of DVT include swelling of the leg or a vein in the leg, pain or tenderness in the area, increased warmth in the skin, and red or discolored skin. In some DVT cases, a blood clot may detach from a deep vein and join the bloodstream. The clot travels from the deep veins of the leg, through the veins of the abdomen, into the heart, and finally lodges in the pulmonary artery or its branches, blocking blood flow to the lungs. This condition, called pulmonary embolism, is very serious and may permanently damage a portion of the lung. If a clot is large, or if there are many clots, pulmonary embolism may also cause death. If you experience symptoms of PE, please tell your doctor or nurse immediately. These symptoms may include shortness of breath, a sudden sharp pain in the chest, a feeling of lightheadedness or dizziness, rapid or irregular heartbeat, or coughing that produces blood. To help prevent deep vein thrombosis and pulmonary embolism, your doctor may require you to do the following. Walk around periodically to keep the blood from pooling in your legs. Wear compression stockings. And take anti-clotting medication.
Pulmonary embolism. A 29-year-old man presents with severe dyspnea and chest pain on the right side. Computed tomographic angiography revealed a filling defect in the main and right pulmonary arteries that was consistent with pulmonary embolism. Definition. Pulmonary embolism, PE, is a blockage of an artery in the lungs by a substance that has traveled from elsewhere in the body to the bloodstream. Symptoms may include shortness of breath and chest pain.
Okay, well, welcome to another MedCram lecture. Today we're going to talk about pulmonary embolism, and specifically we're going to talk about the epidemiology and also the risk factors. In the next lectures, we'll talk about other things, for instance, the diagnosis and treatment. But let's talk about pulmonary embolism, its epidemiology, risk factors, things of that nature. First of all, what is a pulmonary embolism? Well, to look at this, we've got to look at the relationship between the heart and the lungs. As we know, we've got the heart, which pumps blood to the lungs, and also the left side, which pumps blood to the rest of the body. And on each side, we've got the lungs, which sits on the left and the right. Now, of course, we know that the venous system, not only from the bottom, but also from the top, drains into the right side of the heart. And from there, from the right atrium, it goes to the right ventricle. And the right ventricle pumps blood specifically to the lungs. Because of this, any blood clot in any vein is eventually going to end its way up, if it breaks forth, into the right side. Now, because of that, the right side of the heart pumps this clot into the pulmonary arteries. And because the pulmonary artery gets smaller and smaller and smaller and smaller, that blood clot is going to get caught in the lungs and get lodged, and that's what's known as pulmonary embolism. Now, typically, because blood flow typically goes more to the lower part of the lung than it does the upper part of the lung, and that's a result of gravity, more or less. Because of this, you're going to see more pulmonary embolisms in the lower portion of the lungs and less in the upper. Of course, it can happen anywhere, but just as a general rule, since more blood flow goes to the lower portion of the lungs, you're going to tend to see more blood clots lodging in the lower portion of the lungs. Now, is there any predilection as to what side they tend to go on? Now, the answer is not really, but it's possible for it to actually get stuck in the middle where the pulmonary artery branches. That's known as a saddle embolus, and that can be fatal, obviously, because of the large amount of blood flow that gets disturbed in that type of pulmonary embolism. Okay, so what is the incidence of pulmonary embolism? Believe it or not, it's about 600,000 people per year get a pulmonary embolism. And this results in anywhere between 50,000 and 200,000 deaths per year. That's a lot of people. And so I think this is an important diagnosis to talk about. Okay, now that you know what they are, let's talk a little bit about them in general. First of all, we miss them a lot. What do I mean by that? We miss them a lot. They happen a lot in the emergency room and in the hospital, and we fail to pick them up because we don't realize this. And how do we know that we miss them a lot? Because of autopsies. Okay, we see them on autopsies and we didn't even think that the patient would have had them. We also test for these a lot. What happens is they're negative. So we think that they're there and we test and they don't turn out to be positive, and in other cases we don't even think about them, and on autopsy we see pulmonary embolism. What does that tell you? It tells you that we're not doing a good job of picking these things up, and it's probably one of the most misdiagnoses in the hospital. Where do these things come from? Well, most pulmonary embolisms are from deep venous thromboses.
Medical applications may be preventable in those with the risk factors. People admitted to hospitals may receive preventative medication like heparin and fondaparinux, and antithrombosis stocking reduce the risk of a DVT. Following the completion of warfarin in those with prior PE, long-term aspirin is useful to prevent recurrent that can cause damage. Medical application.
Pulmonary embolism, or commonly abbreviated PE, is the topic for this video. And an embolism is essentially a blood clot, and it starts off as a thrombus, or thrombi is the plural, and once it starts moving in the body, it's known as an embolus. And the most common location that these thrombus originate is in the calf area, so lower extremities, and eventually they can travel to the lung, and once that happens, it's known as a PE, pulmonary embolism. And there's something called Virchow's triad, and these three things are what is known as the risk factors for developing a thrombus, and they are stasis. Stasis is also immobility, so somebody, for example, who's bedridden. Endothelial damage, so some sort of trauma or injury that can happen. And the last one is some inherent or intrinsic hypercoagulability state. And all that means is some disorder that the patient has that makes it more likely that they will form a blood clot. So remember that. Risk factors for developing the DVT, the deep venous thrombosis that begins in the lower extremities.
Pros. This illness doesn't have pros cause the patient may die. It's an acute illness, so we have to prevent by changing the risk factors. Cons. Pulmonary embolism occurs in more than 600,000 people in the United States each year. It results in between 50,000 and 200,000 deaths per year in the United States. The risk in those who are hospitalized is around 1%. Applications in Ecuador. This illness becomes more common as people get older in Ecuador because we don't have medical prevention, and rates are similar in males and females. Treatment.
Multiple pulmonary embolisms, an umbrella filter may be placed in the inferior vena cava to retain the emboli, preventing their migration to other parts of the body. Healthcare provider prescribes anticoagulant therapy, for example, oral warfarin, which is Coumadin, Lovenox, or Fragmin, to prevent clot formation. Initially, heparin may be injected intravenously by way of continuous pump infusion. Heparin does not dissolve an existing thrombus. Its role is to keep it from enlarging and to prevent more thrombi from forming. The effectiveness of heparin is determined by monitoring PPT values, which should be maintained at 1.5 to 2 times the normal value. In the event of over-heparinization resulting in profound bleeding, the treatment is IV administration of protamine sulfate. Heparin therapy may take several days. Oral anticoagulation is then initiated. The patient will take warfarin up to a year. The effectiveness of warfarin therapy is determined by monitoring PT and INR values, with the goal being 1.25 to 2 times the normal value. Vitamin K reverses the effects of warfarin. Fresh frozen plasma may be required in cases of severe bleeding. A massive pulmonary embolism must be dissolved by administering thrombolytics such as the tissue plasminogen activator, Activase. Administer oxygen and keep the head of the bed 30 degrees.
Conclusions. Pulmonary embolism are potentially life-threatening occurrences associated with significant morbidity and mortality both in the early and late stages. There are a variety of diagnostic tools that maximize our ability to detect PE and enable better prognostication. Right ventricular dysfunction and the release of cardiac biomarkers are associated with more adverse events. Patients treated with thrombolytic therapy show rapid. Conclusions. Improvement of right ventricular function and pulmonary perfusion may lead to a lower rate of early current PE and a decreased delayed sequelae of chronic pulmonary hypertension.
Pulmonary circulation does not directly provide oxygen to the tissues. Pulmonary circulation functions only to bring blood into close contact with the alveoli of the lungs so that gas exchange or external respiration can occur. The oxygenated blood returning from the body tissues enters the pulmonary circulation as it is pumped from the right side of the heart into the large pulmonary trunk. The pulmonary trunk splits into the left and right pulmonary arteries. The left pulmonary artery enters the left lung, and the right pulmonary artery enters the right lung. Pulmonary arteries continue branching until they form pulmonary capillaries that surround and cling to the alveoli. The exchange of oxygen and carbon dioxide takes place at this junction, termed the respiratory membrane or air-blood barrier. This gas exchange is the process of external respiration discussed earlier. Pulmonary capillaries drain into small veins that join to form 2 pulmonary veins that exit each lung. The 4 pulmonary veins complete the circuit by delivering freshly oxygenated blood to the left side of the heart for distribution to the tissues.
Thanks for your attention.